The state seafood industry is also feeling the effects of the oil spill, especially the oyster supply. Last night, more oyster harvesting areas were shut down as a precautionary measure. Health officials say areas 8 and 9, both west of the river, will remain closed until it's determined that environmental conditions are safe again for harvesting. Area 12, which includes parts of Lafourche and Jefferson parishes, was also shut down earlier this week in advance of the spill's eventual landfall here. Joining us by phone with more on the oyster bed closures is State Health Secretary Alan Levine. Good morning, Mr. Levine. Thank you for joining us. We appreciate it.
Good morning. Good to be with you.
As this thing shifts westward, obviously, which is what folks have feared now for days, exactly how drastic do you think the impact will be on the oyster industry in this state?
Well, you know, obviously, when we see oil sheens or we see any kind of contaminants in the water, we try to close the beds just as a precautionary measure to make sure that we don't have any bad product go to market. Obviously, our primary concern is to protect the industry from having bad product go to market. Now, as you know, we sent a letter last week to the folks at BP to ask for some answers about the use of these underwater dispersants. You know, when oil is rising to the surface of the water, we kind of know where it's going and we can follow the spill. With this new way of doing these dispersants underwater, it's a little bit more difficult for us to understand the science behind that, and that makes it a little bit more challenging for us.
Is there a best guess at this point exactly how long those areas that are now closed will have to stay closed, and will any more areas have to be shut down as well?
Well, we obviously want to reopen them as quickly as we can, but what we've done is we've been doing testing on a daily basis of those beds that are open to make sure that we don't see any increase in hydrocarbon content or anything like that. If we don't see any increases, we would not close the bed, or if we didn't see any oil, we wouldn't close the bed. Now, before we reopen a bed, we will do more testing to make sure that the product is good and it's safe. Obviously, we don't want to have that product go to market. That would be devastating to the industry.
And obviously, what folks need to understand here, we did a piece on seafood industries last night. On the 10 o'clock news here is that if restaurants or stores are still selling it, then consumers should feel safe that the food is safe as well. They wouldn't be selling it if it wasn't.
No question about it. If we have product that's going to market and you're buying it in a restaurant, then it's safe, because we've been watching these beds, we've been monitoring them, and we've been doing testing. And if we see a problem, then we will close down those beds. And so anything that's going out from those beds to market, we have not determined or certainly we have not determined those beds have any problem at all.
And again, just for folks who make their livelihood off seafood in the state, and obviously there are many of them, there's no best guess just yet as to how long the closures may last. We could be talking about weeks, possibly months, worst case scenario, right?
Yeah, I tell you, this has already had a massive impact on the industry. I mean, we're talking about a $3 billion seafood industry that's been basically shut down. And I mean, our prayers go out to the families that are impacted by this, because it's hard for them to imagine not knowing when you'll be able to get back to work. And that's got to be very difficult. We're trying to do everything we can to provide other services, access to nutrition assistance and other types of things that we can do, and small business loans. So I think that there's a lot of work both at the federal level and at the state level to try to help these families out. At the same time, we just don't want to reopen these beds until we are absolutely certain that the product is good to go to market. Otherwise, it could be even worse for the industry. Absolutely.
And let me just briefly switch gears here in terms of the downtown biomedical corridor and the new teaching hospital being built downtown. You just got your hands on an analysis, according to the paper today, about how much the state financially is going to have to support that institution over the next several years. What is your general reaction to those numbers? They seem to be a little higher than initially projected.
Yeah, they are, and this was a report that the governor requested a long time ago to try to get a better understanding of what some of these federal changes, the impact that these federal changes were going to have on our healthcare system. And two specific issues that we face. Number one, we're facing a giant cut this July of $200 million from the federal government. And then again, once the reforms go into place, we face a massive reduction in the funding stream for our public hospitals. And so, yeah, it could push the funding, the state general fund requirements, up over $100 million. So we're concerned about that, but we think it's important that the legislature and the governor have that information now so they can make appropriate plans for it.
And considering the budgetary mess the state's in right now, those increased projections don't hurt the chances of this project coming to fruition?
I wouldn't think so. I think if you look at what most states that have teaching hospitals, they provide significant financial support to their teaching hospitals, and even with this higher amount of money, it does still fall within the range of what, the way they measure it is simply a percentage of expense or percentage of revenue, and the amount of state general fund as a percentage of the revenue is within the range that other states do provide their teaching hospitals. And so I think it's certainly more money. It's certainly it's going to be an issue because of our financial situation, but it's not outside of what you would expect to see with a major teaching hospital.
All right, Mr. Lamine, we appreciate you joining us. Thank you very much.
Yes, sir.